A medical milestone has just been achieved. Huntington's disease, once considered a death sentence, has now been successfully treated for the first time in human history. This groundbreaking discovery, reported by doctors, marks a turning point for a condition that has long plagued families with its relentless progression and devastating effects. But here's where it gets controversial. While the treatment offers hope, questions remain about its accessibility and long-term viability. Huntington's disease is a hereditary disorder caused by a faulty Huntington gene, which leads to the gradual destruction of brain cells. Symptoms often emerge in the 30s or 40s, and without intervention, the disease typically progresses to severe disability within 2 decades. However, new research suggests that early treatment could halt its onset entirely, giving patients decades of good quality life. Dr. Sarah Tabrizi, a leading expert in the field, described the results as spectacular, noting that the disease's progression was slowed by 75% in patients, extending the expected decline from 1 year to 4 years after treatment. The treatment, a revolutionary form of gene therapy, involves a delicate 12 to 18-hour surgery where a modified virus delivers specialized DNA to 2 critical brain regions. This process, guided by real-time MRI scans, aims to silence the toxic Huntington protein responsible for neuronal damage. While the therapy is still in its early stages, preliminary trials show promising outcomes. Patients who were expected to require wheelchairs are walking, and one participant has returned to work after being medically retired. Yet, the road ahead is fraught with challenges. The procedure is highly complex and costly, raising ethical questions about who can access this life-changing treatment. For families like the May Davises in the UK, the implications are profound. Jack May Davis, who carries the faulty gene, watched his father suffer a slow, painful decline before passing away at 54. Now, the possibility of delaying or even preventing the disease has given him a renewed sense of hope. This breakthrough has left me overwhelmed, he says. It's like seeing a light at the end of the tunnel. Despite the excitement, critics argue that the high cost of the treatment may limit its reach. While gene therapies are often expensive, like the £2.6 million per patient gene therapy for hemophilia B in the UK, the long-term benefits could justify the price. However, many wonder, is this the future of medicine, or a luxury reserved for the few? As Dr. Ed Wild, a neurologist involved in the research, admits, it's hard to fully capture the emotion of what this means for families. As the therapy moves toward approval in the US and Europe, the world watches closely. Will this be the dawn of a new era for Huntington's disease, or will the high cost and complexity prevent it from reaching those who need it most? The answer lies in the hands of scientists, policymakers, and the people whose lives are at stake. What do you think? Can we afford to wait for a cure when the disease is already taking lives?